Hello, and welcome to our webinar on communication strategies around the Family First Prevention Services Act. My name is Michael Umpierre, and I am the Deputy Director for Juvenile Justice System Improvement and Communications at the Center for Juvenile Justice Reform at Georgetown University's McCourt School of Public Policy. We're delighted that you're with us today for what will be an excellent opportunity to discuss strategies for communicating around implementing the Family First Prevention Services Act, the landmark piece of federal legislation signed into law in 2018, which aims to reshape child welfare practice by, including many other things, enabling jurisdictions to use Title IV-E funds to support prevention efforts. As part of today's conversation, we'll hear from leaders in two pioneer jurisdictions with respect to Family First implementation, namely Utah and the District of Columbia, each of whom will offer examples of internal and external messaging approaches that they're currently using, as well as lessons learned from the process. For those of you who may not be familiar with CJJR, we are a national organization that supports the youth-serving field to advance a multi-systems approach to meeting the needs of young people and families. A central component of our work is the provision of dynamic training and technical assistance programs designed to support system officials, partners, and stakeholders at the state, county, and local levels. This includes our certificate programs, which are week-long intensive training programs, our site-based practice models, including our crossover youth practice model and youth in custody practice model, and other field-building initiatives. For the purposes of today's webinar, it is particularly relevant to share with you that one of the key initiatives we operate at CJJR is the Public Information Officers Learning Collaborative, otherwise known as the PIOLC. With the support of Casey Family Programs and the Annie E. Casey Foundation, and in partnership with the Justice Policy Institute and Strategic Communications Advisor Kathy Bonk, the PIOLC is designed to support public information officers and communications directors who work in the child welfare and juvenile justice systems around the country. As part of the PIOLC, each year we bring together approximately 30 PIOs working in child welfare and juvenile justice for a multi-day convening at Georgetown to discuss current and important topics related to communications. And indeed, on the screen, you see the beautiful photo of our group that we convened earlier this year. We've successfully operated the PIOC for more than a decade now, and I want to take a moment to acknowledge all of the wonderful individuals who are part of this network of PIOs, many of whom I know are listening to the webinar today. It's quite affirming from our perspective to know that the youth-serving field benefits from such an incredible cadre of communications professionals who are so dedicated to improving the lives of kids and families. As I mentioned, today, we are talking about messaging around Family First, and indeed, this topic has been one of great interest and importance at the PIOLC table in the last few years. We know that jurisdictions all around the country are at various stages of implementation of Family First, some slated to implement it in 2020, others in the years to come. And so it's our pleasure to be able to feature three of our PIOLC members today, representing these early adopter jurisdictions, to talk about how they're approaching the messaging and for them to share their valuable insight. I want to be clear that today's presentation is not intended to be a primer on the ins and outs of the Family First Prevention Services Act itself. For those interested in learning about the Act and what it sets forth, share some online resources at the end of the webinar that you can reference. Again, today's conversation is primarily about how do you communicate around implementation, both internally and externally. So, before I introduce our wonderful presenters from Utah and Washington, D.C., I do want to give our partners at Casey Family Programs an opportunity to offer some brief welcoming remarks as well. And to this end, it's my pleasure to turn the floor over to Cindy Santos, who serves as a partnerships advisor at Casey Family Programs in the System Improvement National Partnerships team, and is also an instrumental member of our PIOLC planning and partnership team as well. Cindy, the floor is yours.
Good afternoon, and thank you so much, Michael, Here at Casey, we're appreciative of the unique partnership we have with the Center for Juvenile Justice Reform, and we see the important work that PIOs do in jurisdictions, particularly around family first, as crucial to conveying the message that we're in the process of transforming our approach so that we're not just a system of child protection, but a system of child and family well-being. And we realize that to really see the full potential of family first, we have to engage a variety of stakeholders and really garner the commitment of a community of people who believe that this new approach is possible. And so we hope that the strategies that are presented today by these family first trailblazers will inspire all of you, provide some ideas, and really result in some innovation and some peer-to-peer learning. So with that, I'll turn it back over to you, Michael, and look forward to the rest of the webinar.
Thanks so much, Cindy, for those remarks. I want to say that we also appreciate our partnership with Casey Family Programs. Everything that Casey Family is doing to support the PILC, this webinar, and as well as the longstanding support of the youth serving field at large. It's just truly appreciated, and we thank you for all of those efforts. Without further ado, I would now like to discuss some webinar housekeeping items and introduce our presenters for today. The structure we'll use will be as follows. First, we'll hear a presentation from our colleagues in Utah. Then we'll hear from our colleague in Washington, D.C. And finally, we'll host a question and answer period where our presenters will address questions from the audience. Please note that we will not be opening up the phone lines for this webinar. Instead, what we're asking you all to do as attendees is to submit questions using the questions box that you see on your screen. As our presenters speak, simply type in and submit your questions using this box, and we'll do our best to address as many questions as possible during the Q&A period at the end of the webinar. In the event that we're not able to get to every question today, we will be sure to follow up with you all, addressing those questions in a written document that we'll post publicly on our site. Please note that today's webinar is being recorded as well, so that individuals who perhaps were unable to be with us can still benefit from the information at a later date. The webinar recording and all related resources will be posted on our CJJR website. We'll provide you with the link at the end of the webinar. And we'll also be sure to include that in a follow-up message to all webinar attendees. Okay, so let's get down to business. It's now my pleasure to introduce our distinguished presenters for today. First, from the Utah Department of Human Services, we have the dynamic duo of Heather Barnum and Ashley Sumner. Heather Barnum is the Communications Director at Utah DHS, where she manages the organization's communication strategies and approaches, including providing strategic direction, crisis management, creation of proactive media opportunities, and everything else under the sun related to communications. Heather has nearly 20 years of experience managing strategic communications across public, private, and agency sectors. She has her accreditation in public relations, is a frequent trainer and presenter, including at our very own PILC. So we tap her to present at those convenings. She's the past president and longtime board member of the Public Relations Society of America, Greater Salt Lake Chapter. And Heather has degrees in communications and public relations and Spanish, as well as a master's degree in public administration. Ashley Sumner is the public information officer at the Utah Department of Human Services, where she works closely with Heather on all things related to communications. Prior to joining the department, Ashley served as the PIO for the Utah Division of Child and Family Services, and also worked in communications at the Utah State Legislature and for a local mayoral campaign. Ashley has a wealth of experience and expertise and is a graduate of the University of Utah with a degree in strategic communications. And finally, representing the wonderful District of Columbia is Lydia Sermons, Communications Director for the DC Child and Family Services Agency. Also a member of our beloved PIOLC, Lydia has had a truly remarkable career in communications, including direct experience across the federal government, including at the White House, the U.S. House of Representatives, U.S. Treasury Department, HHS, the U.S. Food and Drug Administration's Office of Regulatory Affairs. I think the question is not where Lydia has worked, but where she hasn't worked in the federal government. Lydia has done all of that in addition to working locally in the private sector and with national nonprofits, including notably working with the Black Women's Health Imperative, a national organization that advocates for the health and well-being of women of color. Lydia has a BA in communications from Temple University, a master's in broadcast journalism and public affairs from American University, and a certificate in corporate community relations from Boston College. You can see why we're so fortunate to have these folks with us today to talk about this family first piece and to share their insight. So with those introductions out of the way, I would now like to turn it over to Heather and Ashley. Heather and Ashley, as you know, when you're done with your 15 and 20-minute presentation, please pass the baton off to Lydia. Lydia will offer remarks and then pass it back to me, and we'll proceed to the Q&A period. And as one final reminder for the audience, please keep those questions coming early and often. Please don't be shy with submitting your written questions, as we're hoping to use them to drive the Q&A period at the end. So with that, Heather and Ashley, the floor is yours.
Well, Michael, thank you so much. This is Heather, everyone, and thank you so much to the Center for Juvenile Justice Reform and, of course, Casey Family Programs. And I'm so honored to be part of the PIOLC and to interact with you not only in our once yearly, but throughout the entire year. I learned so much through our email communication, and so keep it coming for sure. And I'm grateful for Utah being able to present to you today as an early adopter, mostly the communication strategy that we've taken through this planning phase, because of course implementation is a whole other strategy once you get it going. But the question of reform principles really are the same, but we recognize that each state is going to take their implementation a little bit unique. And so our goal today is to share among you just our general communication approach, some of those tactics that we used that might be useful to our audiences, but may also be useful to you, how we message through some challenges, lessons learned, and what might be those next steps, and then ask you to maybe connect those dots of what might be helpful or relevant in your state. So really from the time that we got the surprising news, I think to all of us, with the Family First Act in February, Utah has been committed to an October 1 start date. It was our Senator Orrin Hatch at the time who played a large role in developing the act. And he also had our executive director of DHS at Congress presenting and testifying on why we needed this, the Title IV waiver that we were part of, to continue in a permanent function. We have also been gratefully alongside Casey at advocacy events and with some of those original legislation. So it really was something that Utah was committed to from the beginning. And we also knew that it needed to be a department-wide effort, that we were going to look at the totality of our human services system and not only focus on the child welfare impact. And so even with that foundation of the 4E and leadership support, we knew that October 1 was ambitious. And so we started to message it as we're sprinting to the starting line, that we're not trying to get to the finish line there. And Ashley, if you could, are you advancing? I'm not seeing the slides advance, so apologize for that. Our approach that we took is really twofold in our communications. One, we wanted to get a seat at the table at the very beginning. And we'll talk a little bit about how we did that with the implementation planning team. And then also we knew we needed to keep it simple. One, it wasn't going to be our only our only job, Family First. We had all of our other responsibilities as a communications team. but also that we had enough established communication channels that we really could keep the message simple, especially through this planning stage, and really focus our attention on what was relevant and necessary for our audiences to know so that we could get to that October 1 start date. So the first approach of finding a seat at the table, we knew that our executive director believed that child serving agencies at the Department of Human Services should all be involved. It was really a system-wide view. So that at our department includes child family services, but also juvenile justice services, services for people with disabilities, our behavioral health, our Office of Licensing, finance, our data team, and also our contracting and Office of Quality Assurance, which is really important as well in this effort. We were really lucky to have a leadership already that values the role of communications as a strategic function, as a member of the leadership team here at the department. But we also knew that we wanted to have a significant value to this effort that was so important to how we were shaping our practice for so many children and families in our state. And so we took maybe a little bit of a non-traditional communications role where we said, you know what, we have skill sets as a communications team that are in project management. And this is largely a project management role that we need to address. So we offered, and I voluntold Ashley Sumner, my PIO, to offer that we would have one of our communications members actually project manage the necessary moving pieces for the implementation team. And what that did is we were part of that steering committee where the planning discussions were happening so that we could maintain that strategic voice in how decisions might be viewed by audiences, and also how to message the anticipated reactions as those decisions were happening. And so if you as a communicator are struggling to get a seat at that planning table, maybe think of offering some of those outside of the box skills to your management in strategic planning, in project management, even in meeting facilitation that will get you involved early and often. So I'll turn the time over to Ashley since she was the project manager for the effort and to tell us a little bit about how she used those communication skills to help that team.
Thank you, Heather. Sorry, we are having a couple issues with the slides, but this should be great. So in the project management role, we facilitated work group expectation setting, project and task tracking, agenda setting, and communication between all the groups, which included the steering committee, multiple work groups that represented the individual family first provisions. We also created some project management tools for the implementation team, including work group plans, task project tracker, and then this Google site that you'll see pictured. The Google site served as sort of a repository for all the many documents that we're receiving. As you know, you get federal guidance and Children's Bureau documents, as well as meeting minutes and any comms that you develop. So we use this to really manage the deluge of documents that we were working with to keep everything organized and accessible to everybody that was part of the project management implementation team. And all right, so here you'll see the actual task tracker that we used, that we developed in our project management role. This document really kept us focused and allowed us to make the best use of the steering committee time and their role. We really wanted our steering committee and needed our steering committee to be a barrier-busting, problem-solving group that, and our meetings couldn't just be for updates. We wanted them to really be moving the project along and not micromanaging the work group's work. This is actually kind of a shift for some in the group. We had to really work with them, have lots of one-on-one conversations to get to the core issues that were the barriers, and also to elevate things at the right time So that required a lot of communication and messaging. As a project manager, it was my responsibility to work with individuals and work groups and steering committee to keep this document updated so the steering committee and other work groups could view it at any time and understand where we were with key milestones. Let's see. So as Heather mentioned, part of our approach was to really keep it simple. We were very committed to October 1, but we also had a lot of work to do with no additional resources. So due to this compressed time frame, we made the strategic decision to just use established communication channels and focus on internal audiences, primarily with secondary focus on external audiences. And this is often our standard approach when we're looking to initiate change or a communications effort within our department. This gives us 4,200 mouthpieces to communicate our message on the ground. Our message to internal audiences was actually only partially the philosophy behind Family First. A lot of it was why it was so important to capture this opportunity moment and start October 1. Many felt that we weren't ready or didn't have the capacity, or that we were setting expectations too high too soon. Due to these concerns, we felt it was important in our messaging to share successes along the way, quick wins, and give our internal audience the confidence and opportunity to reflect on how much we had accomplished so that they would have the confidence in our message.
Did I do that? I just made you an
and that we were ready for October 1. So to deliver this message, as we said, we used established channels and we added Family First to everything. Our employee newsletters, social media, meetings, provider roadshows, legislative hearings, cascade emails, every training presentation that we did, we saw an opportunity to add Family First. We also kept it simple by using existing tools from KC and the PIOLC. As you will see in the messaging documents the documents that we share in our presentations, we borrowed heavily from the resources made available by our national partners. Some of the things we were able to create, thanks to this foundation that was so generously given to us, were overall one-pagers, messaging, slide decks that we were able to repurpose over and over again, one-pagers on the evidence-based programs that we were introducing to the state, and a bunch of other things. We kind of do this with every project. We look to see what's already out there, what resources are already available, and can we adapt them. And then we also use strategic redundancy. So people will see these documents and the words in these documents and the messages in these documents over and over and over again, because everybody's busy and we want to make sure that they understand the message. So although we were focused primarily on our internal audiences, we also always want to have a media strategy, obviously, and this is such an incredible opportunity to share successes with the media. So to reach a broader audience and reach key stakeholders, we look for milestones and issued press releases for things like a prevention plan submission, our October 1 implementation, and yesterday we issued a press release that was also sent to stakeholders, lawmakers, providers, and staff about the approval of our Family First Prevention Plan. This is something we do anytime we send a release. We send it to it or a version of it to providers, advocates, lawmakers, internal staff, and we also post it on our intranet, blog, and social media. We also searched for feature story opportunities that could really put a face to Family First. The story you see pictured is one that ran on the front page over Thanksgiving weekend, and it featured a mom who had received in-home services. It was actually flown with us to DC by KC to celebrate the passage of Family First. I'll turn the time back over to Heather to share a few more additional external pieces that we created.
Thanks so much. You can see why Ashley is such an asset to the project management, and I'm appreciative of her. So for the external audiences, we really focused, again, because of this shortened timeline, something my team hears from me all the time is that we communicate when it's helpful. Because if you're just communicating noise, it becomes something that they don't know how to act. There always needs to be that call to action when you're engaging with your external audience is in particular. So we focused on what are those practical application communications that we needed and really what the service needs were of our prevention plan as we were developing that for submission. So we knew initially that we were going to have a service gap, especially with our evidence-based programs. So even though we're sprinting to that starting line, we knew that we were going to need to enlist our providers in a very meaningful way to provide new services or to provide their services in a different way. But we also were making decisions along the way, so we needed to wait until we had relevant information that would support the implementation plan of enlisting providers in the effort. But we needed to already have some of those decisions made, like the training and contracting opportunities that we were developing and then eventually providing to our partners to offer. And then also just that capacity building, even educating, especially once the clearinghouse came out with their list, educating our providers on what are those programs that were cleared and why they should be looking at providing those services so that we could prioritize those under the new funding structure. We also solicited their feedback along the way. We were out in the provider roadshows, the presentations that we give regularly to associations, even in our legislative testimonies, and having providers part of our work groups as we develop some of this service capacity, and asking them through surveys and other communication tools that we have in place of what would be their interest in technical assistance, what might be their interest in participating in some of the contract development for these services. So one of the things that we also did was just create a page within our existing site about Family First that became similar to that project management tool for the steering committee and work groups, but it was internally or externally focused as a repository. And then just a couple of messaging challenges, the why. The internal folks, Ashley talked about having some hesitation, but our providers also were seeing that there were capacity issues. Why was Utah needing to go October 1? And so we made sure we are a Start with the Why organization. We made sure to address that through something that wasn't part of our original communication plan, but we produced a why card that we had in hand when we met with providers or when they met with others, so that we could share why we were so committed to the principles within the act and why Utah was not going to wait. Some of the lessons learned that you can apply is just to communicate that progress honestly. Even in the why, we said, yeah, we're not totally there yet, but we're going to get there because it means that much to our children and families. And that we have a good foundation started with the principles that are already in practice here in Utah. Also, just piggybacking on the tools you already have. Go where you're already there. Strategic redundancy is really important. And then also, we just got through the planning phase. We just got our plan approved yesterday, which is huge. And so continuing that communication effort in even more of a meaningful way with the outcomes, especially internally and with our providers, doesn't stop once the plan's been approved. So what's next? We are transitioning more to maybe some external communications. We have an op-ed planned in January. We've got some features for each of the core principles that we're developing to pitch to media, putting those faces to the principles as well. And because telling this story through a face, I know we've talked a lot about this in Georgetown, is so important to a human services media approach. And then internally and with our providers, we really need to focus on the evidence-based program utilization. We're working very closely with our contracting team and the internal teams that are trying to not only get capacity built, but also making sure that our frontline knows about these services so that they're choosing them as a priority. So that's really our focus. And I know that Lydia is going to share some really great tips as well. And I'm really looking forward to hearing from her too. So I'll pass the baton. Oh, there was another racing joke. Okay, passing the baton. There you go.
Thank you, Heather and Ashley. Great job. And thank you, Michael, for the opportunity to present on the webinar today. And welcome to all of you. I am pleased to represent the District of Columbia government, which, as you know, is not a state, although, you know, there's that desire to be considered as such. But we are a jurisdiction that's smaller than a state. And but our agency, the DC Child and Family Services Agency, actually functions as the state organization that would be the Child and Family Services, that would be the equivalent to Ashley and Heather's organization. So what I would like to share with you is some of the process that our agency went through to ramp up for implementation of the Family First Prevention Act. Now, with CFSA, which is the short name for Child and Family Services Agency, the planning process for implementation of Family First started a year before I came on board. So my predecessor would have been at the table, as you saw with Ashley and Heather, to steer some of the project management. So my perspective is not going to be all-encompassing because I literally came in at midpoint and the process was well underway. So not having a comms person at the table when the planning process was started, what our agency chose to do was leverage our community partnerships team to actually form a cross-agency, cross-sector working group. And that included staff from our agencies, our partners, providers, our sister agencies, everyone that would have a role. And it was a citywide, and so our communications was really focused through our partners through this family work group. And the work group came up with a clear charge of what they wanted to accomplish. And it was called the Prevention Work Group, as you see here. And here are all of the components of participants that participated in our work group. And a significant one that I want to point out is our upstream services, some of the subgroups, upstream services, a group that really targeted and focused heavily on the populations that we really needed to make sure that we are serving, and the evidence-based programs and outcomes that we wanted to achieve. Next slide. Okay. And here are some of the core areas that we wanted to focus on. So again, you can see the broad representation of those that were involved from outside of the organization, but internally, we also had a team that participated on that work group. So our policy, evaluation and reporting team, our budget and fiscal team, contracting, of course, communications, supervision and training, our case carrying administrators, and really important was our IT team, because our system, our child welfare information system that we use for documentation is actually in the process of being overhauled. So there was some rebuilding of this system that was underway, but the timing of it allowed us to also restructure our IT system in a way that it would support implementation of Family First. Next slide. So these are some of the focus areas of our internal team, looking at our congregate care analysis, claimant and fiscal impacts, practice and IT systems, building evaluations, and of course our CQI capacity internally. And again, just to give you an overview of the internal communications. While it was internal communications, it also included our external stakeholders. So everyone had a seat at the table, as you can see. It was a pretty expansive work group that met over the course of a year. Our community partnerships team that led this working group also set up feedback loops to ensure that all of the planning and conversations were captured and reviewed to see how it could be worked into informing our Family First plan. Next slide. So this was the work plan overview, and this gives you the timeline for the actions that took place. So there was foundation setting that took place June through September of last year. And then, of course, there was the review and analyzing what came out of the conversations, the recommendations, and the work group meetings. And so earlier this year, our community partnerships team, along with our working group, began drafting our plan. And our director, Director Donald, was very, very focused on ensuring that we were actually ready to run with implementing our systems that were being rebuilt and modified to support the launch of our Family First prevention plan, whether it was approved or not. We were planning on being ready. And so our plan was submitted to the Children's Bureau back in April. And of course, there was some back and forth in terms of feedback and recommendations that took place. And again, we were preparing to launch in October, and October we did. So we're at a phase now where we have launched, and we are reviewing and evaluating and making system improvements as needed. Next. So it was very important for our Family First plan to be integrated with our 4-pillar strategic agenda. And so these 4 pillars are really key to how we develop and administer our programs and how the agency operates. So we have what we call our 4 pillars. Our front door is that first pillar where we try to, our focus is to make sure that children remain with their families. So we want to narrow the number of families and people that actually enter into our front door. And the second pillar is the support that children receive when they come in. We're very, very focused on ensuring that from day one, that the focus is on moving children through the system in a manner that helps them feel safe and cared for, but to ultimately get them out of our care into a permanent setting or reunified with their families. And so during that process, we focus on their well-being, which is another key pillar of ours, through whatever health needs that they have, growth and development needs, education needs, academic needs, and other supports. And ultimately, again, our focus is on getting children out of the system into a supportive, loving family and home. Next slide. So I just wanted to share this because in terms of communications and planning, the community partnerships team set up this theory of change, which really focused the goals and outcomes and strategies of what our plan would cover. So taking a look at our target population, identifying, assessing, and how that target population would be engaged, the interventions that would be needed, the proximal outcomes, distant outcomes. So all of this information was key to informing the plan that, again, our community partnerships led the planning and development of, but it really was an integrated process across all the representatives of our work group. Next slide. And again, this goes a little deeper into the target subpopulations that our agency really focused on in terms of planning for Family First. And so the communications that took place, again, was really more along the line of the providers, some of our parent groups that are impacted, as well as our community partners. So, excuse me, again, the communications was really across the working group, not so much the public, which, because our goal was to get the plan right, make sure the plan reflected the needs of the communities and the populations that needed to be served. So again, part of the conversation, again, mostly internal across the work group, matching our population to their services, and those main services were in-home parenting services, substance abuse services, and mental health and cross-cutting services. So heavy dialogue, lots of meetings, lots of information sharing that took place. Okay. As well, our Mayor Muriel Bowser, and our Director Brenda Donald had also really been focused on looking at how we continue to expand services across the city, a citywide approach to prevention services, a citywide approach to strengthening families across the district. And so instead of looking at our prevention from a narrow perspective, Director Donald and the mayor really said, you know, let's take a step back and really look at our services across the entire city that will help strengthen our families and successful outcomes and help families to survive and thrive in the District of Columbia. And also taking a very focused look at the communities that had some of the greater challenges in terms of services and outcomes and health disparities. And so what you see here is a bigger picture, a bigger conversation between our mayor, which was great, and our director to say, you know, let's look at family first, which is going to give us resources to focus more on those families that are in crises, as well as help prevent child abuse and neglect. But let's go deeper and let's go further upstream and build a citywide agenda for our prevention services. And so our mayor actually came up with a local initiative that she funded in this year's budget to supplement and help expand our services, which is called the Family First DC Initiative. Next slide. Okay. And so here you have a combined program. So not only do we have the Federal Family First Initiative, but we have the Families First DC Initiative. So Family First being an evidence-based program to support pregnant and parenting youth in foster care and foster care candidates is the focus of our Family First plan. But we wanted to look across the district and say, you know, beyond this population, which is a core population that we really need to focus on, we also need a broader strategy to go further upstream to help reduce the scenarios that will get families to our front door and into our services in the first place. So you see here now a bigger, broader strategy that our mayor and the director decided to develop. And that was from internal communications and a desire to have a broader impact. Next slide. And so all these conversations were taking place, and then comes Lydia and a new communications team to say, okay, now that we have when I came on board, the plan was actually being written and our internal communications was our bigger focus. And that communications was to keep the working group up to speed on where we were in the process, keep our staff up to speed on where we were in the process, as well as our partners. So once we realized the plan had been drafted, it was just, again, keeping everyone up to speed on timelines and what to expect. Once the plan was submitted, and part of that also, too, as Heather and Ashley mentioned, ensuring that we talked about our Family First plan in our oversight hearings with City Council, our stakeholder briefings, and we began to develop fact sheets, starting with an internal fact sheet, just to help our own staff understand what Family First was, why it was important, and even more importantly, the training that would begin to take place amongst our staff, the system improvements, and how it related to their jobs and the outcome of what they needed to do to help institute Family First. So we started with internal, and then we eventually built out to external. And of course, much of our communications was very focused, again, internally, and then just those key publics that were part of the process. As we got closer, once the plan was submitted and was under review, we did develop a press release to announce the plan approval, and we actually had a brief ceremony because there was a lot of momentum around our plan, because DC, we were the first jurisdiction to actually submit our plan to the Children's Bureau, and we do have the benefit of proximity, since the Children's Bureau is in the District of Columbia as well, our agency. We have the benefit of having Jerry Milner, the Associate Commissioner for the Children's Bureau, who is pictured here with our director, actually come over to the agency for a brief ceremony to announce the approval of our plan. And so on event day, we basically did a press release, a media advisory to announce that we were going to have the announcement the next day, and we had a brief in-house ceremony with members of our working group. We conducted social media and, of course, memorialized the event with some photos that we also pushed out on social media, and proudly stated that the District of Columbia was the first jurisdiction to submit and have their plan approved by the Children's Bureau. And so what's next for us is I'm literally in the middle of Monday rolling out that mayoral initiative, Families First DC, with our director, and Associate Commissioner Milner is actually going to join us when we roll out on Monday the other piece of that pie that you saw, which represents Families First DC. And so what we have here is a broader citywide upstream strategy that is now being implemented that includes a the federal Family First plan, as well as our local DC Families First plan, to really build out prevention efforts for our families. And so that's where we are, and I'm happy to answer questions, and I'll pass it over to Michael.
Wow, thanks so much, Lydia, and to Heather and Ashley for those great presentations. We are very fortunate, folks, to have these leaders from the jurisdictions in the country with the approved Family First plans. So DC very proud about being the first, and Utah being the second, and we've got those folks with us today, which is a real treat. We have had several questions come in. Folks who are listening to the webinar, please continue to send those in via writing. We'll do our best to address as many as possible. But I want to start off with a question about the internal process that you've taken. I'm going to start with a question for Heather. The question that has come in is about buy-in and perhaps any resistance that you may have seen to go down the road of Family First. And as you think about the internal strategies that you employed, did you face any resistance, any pushback, Heather? And if you did, what were some of those major points of pushback, and how did you try to address them? How did you try to achieve that buy-in? So I'll start with Heather, and then Lydia, I'd love to get your thoughts on this question as well. But Heather?
Yes, thank you so much for that question. It really was a daunting task for folks who this would need to be on top of their already busy work and jobs to really get to that starting line of October 1st. And so I think the first reaction was not about the principles not already being aligned. We had a really strong core value already in the principles of the Family First Act, having been a waiver state, having already done a lot in our in-home services. But so it wasn't the why, it wasn't the good in the act that was challenging, it was just the time that was going to be involved in the resources. And we have the benefit of leaders who were able to pivot some core personnel to really do this full time almost in leading the work groups. But as far as a communication strategy, that was central to making sure that we're presenting the wins along the way, or the core decisions that were helpful and relevant to our staff, but also making sure that we didn't go so far to make them think that we were already there, that we didn't need their help in learning more about the evidence-based programs, in using those, and also in just the gaps that we still had in the service capacity need. And so that was, I guess, some of the strategy that we took internally, but the why wasn't the issue. It was the how we were going to do this in the time allotted, and just managing those expectations.
Very interesting. Lydia, from your perspective in DC, was it a similar approach there? Did you see any resistance to going down this road? What was your experience like?
So in terms of the community, as Utah was, we were a Title 4E waiver jurisdiction as well. So our team had their, so it was more the what's going to be different about this in terms of the community, and messaging to them, how it's going to, the how factor, how it's going to further benefit, and the importance of having their input at the beginning of the process. In terms of communications, ours was really focused on internal, helping staff, because again, everyone had their day-to-day, and it's like, okay, this new thing is coming. For our staff, because of the training requirements, that was the intense communications, having our senior staff members communicate down to their specific staff, literally through PowerPoint presentations. This is the training that's coming. I know you're busy. The social workers are busy, but we've got to build this space out for you to do this training so that you're ready. Our plan was actually, we were ready to go on October 1, but our plan was actually approved on October 30. We had actually done a soft launch because we were just determined to be ready. So there was really, really, again, intense communications, all staff e-blasts, staff meetings to just help, and posting those training modules to help staff get ready. That was the biggest piece for us.
Can I also say that the training that Lydia had in place and how closely she was aligned, that's actually a lesson learned that we've reflected on in Utah. We wish we would have been more aligned with our training folks as a communication team, so that when they were sharing process and procedures, that there was also a real message of the core reasons for the why, and also how it would be better and how we expected it to produce better outcomes, and not just focus on the procedure that we didn't do as well with our training folks. So lesson learned, get with your training folks early as well.
I can't stress it enough. We were really embedded with our training teams, and every internal communications vehicle we had, we leveraged it, our intranet, our internal newsletter, staff meetings. So that was a critical piece.
Excellent. We do have a question here about the family engagement, and particularly in messaging. The question is, what were some of the best ways that you found families to be featured in some of the media stories around Family First and other public content? Ashley, can I turn to you? I know that you were discussing the Thanksgiving story a little bit. How did you partner with families and feature them in some of the messaging approaches that you took in Utah?
Yeah, it's always a challenge to get a face, especially given our clientele. But we are always looking for stories we hear from like caseworkers and program managers, and asking them to be on the lookout for individuals that may be willing to share their stories. So I think Heather mentioned in our next steps is we've kind of built out an editorial calendar where we want to highlight each of the provisions with an internal story. So yeah, we go to our program managers, we go to the individuals that are actually working with families and say, hey, do you have somebody in mind that would be willing to share their story? And then we really use kids kid gloves with these folks and make sure that they are fully prepared for the experience, and make sure that they, you know, whatever will be shared, they are completely comfortable with. So yeah, I think it's just a lot of really working, being really respectful, and then constantly keeping your eye out for individuals that may not work for something you have in mind right now, but to keep them on the back burner and circle back to them when the time is appropriate.
Great. Thanks for sharing that. We've got another question here coming in about the fact that this is very much an iterative process in terms of planning around Family First and implementation. And the specific question is, how do you manage communication strategies when you're building the plane as it's flying? The person asking the question is saying in her jurisdiction, there's a tendency for folks to want to have a thorough grasp on the path forward before communicating, and it can leave some stakeholders in the dark by operating that way. So what would your, Lydia, let me start with you. What would your advice be to communications professionals who are in this state of, building the plane while we fly it, and how do you navigate that from a messaging standpoint?
Well, the stakeholder communication is really key. Having that work group. So even if you have community partners that you work with that impact and influence and help inform your policies and programs and services, the best thing to do is bring them to the table and just do direct messaging to them. This is where we are. And it's leadership's responsibility to figure out like how they really do engage. But when they're brought in, it's the communications team that helps to message what's going on and where you are in the process and what's needed from them, and to help just manage the whole feedback loop. So that's key, because what I had to do, our team started asking me early on, well, what's the communications plan? I said, well, we need to sit in on the meetings and see where you are in the process and see what's coming, and I can build a communications plan as you're building a plan. But the initial stage is to make sure the stakeholders are represented in what it is we're doing, and then keep them abreast of where things are in the process. So, I mean, that was the early piece for us. But again, our team did keep asking, well, what's the communications plan? I said, well, I need to see the plan. We need to sit in on the meetings and listen in. So even if you don't have an active role in developing the plan, it is important to be in the room to hear what's going on, because you'll organically start to pick up the language and understand. So it helped me be able to message to our staff, oh, this is why our staff needs to go to training, because these are the systems that need to be in place in order to fully implement this. So sitting in on those planning meetings early is very important.
Thanks, Lydia. I see that we have. Please.
It was really about focusing on the why, because we didn't have the outcomes yet. So, and then what we needed from each of the groups, or what would change. So what did we already know that would be helpful? And that's where we really focused our message, because it's like, it was exactly that. We said we were gardening or we were pulling the weeds as we were laying the seeds, and that was also important to engage our provider advisory group, our family voice on our integrated service delivery steering committee. So not trying to say we have outcomes yet, but why we were doing it and what did we need and what was going to change.
Right. Yep. That's key.
So I think we've got time for one more question, and then I'd like to close things out. But this question is for Utah, Heather and Ashley. Lydia mentioned, the benefit of having the Children's Bureau basically in her backyard here in Washington, D.C. The Children's Bureau also has regional offices around the country. Did you happen to partner with some of those regional offices? Do you think that's a resource here for folks around the country? And if so, do you have any advice as to how to approach next steps in working with the Children's Bureau in that way?
So we have an incredible federal program manager, Cosette Mills, who's really has been the key person in this whole implementation. And she works really closely with the Children's Bureau. I believe they're in Denver. For our communications and project management role, we didn't really work closely with the Children's Bureau except to, I know Cosette worked really closely with them in, getting questions answered and that kind of thing, but not from a communications or project management perspective.
Great. Well, we are at our time. Thank you for that response. Before we close, I do want to acknowledge we have been getting a lot of questions about the resources and materials, including the PowerPoint. We will be sure to follow up, as we mentioned, on the CJJR website with all of those materials. We've gotten specific requests for some of the materials that were featured from Utah and DC, and so we'll work with our partners there to see if we can get some of those tools shared as well. But in the meantime, we did want to lift up several resources that folks should be aware about. The Casey Family Programs has a great website focused on family first. News, updates related to implementation. Casey's a tremendous resource, so we encourage you to continue your contact with Casey Family Programs. For a communications toolkit on Family First, please be sure to take a look at the Annie E. Casey Foundation website. You have the link there. There are a number of tools involved in that, including talking points, visuals like a message box tool, tips on language to use around the planning and implementation, and other helpful guidance. And then finally, as I mentioned, our CJJR page will have those resources. I want to thank Heather, Ashley, and Lydia once again for their time and today and in planning for this webinar, all of our partners at the PIOs, including Casey Family Programs, the Annie E. Casey Foundation, JPI, Kathy Bonk, and last but not least, our fabulous program manager here at CJJR, Hannah Opperman, who's been working nonstop behind the scenes to make this webinar happen and all things PIOs related, as well as CJJR's Alex Perry, who assisted with webinar coordination and PowerPoint development. I hope you all found great value in this. I know that we probably could have spoken for another hour or more on it, so let's stay in touch. Take care, everyone, and happy holidays.
Thank you.